As the U.S. is turning a corner in the fight against COVID-19, conditions in India are getting worse. Over 86,000 new cases were reported yesterday, the biggest one-day increase on record for any country. The total number of infections there has now passed 18 million, and yesterday there were another 3,500 reported deaths nationwide. President of the Public Health Foundation of India, Dr. Srinath Reddy, joins me now for more on this. Dr. Reddy, thank you for being on today. First, can you just start by painting the picture for us? Just how bad is it in India right now? What's it like when you go to a hospital there?
It is quite a grim picture. Many parts of the country are seeing a huge surge of cases, with a number of people rushing to hospitals. But the state of the hospitals in terms of the ability to receive and treat them is varied across the country. While in some of the states and big cities, there is a huge rush which cannot be accommodated, and people are waiting to get admitted, get oxygen. Some of the South Indian states are coping well, despite the very large rising numbers, because they have actually built up fairly good health systems for a number of years. But in cities like Delhi, there is a tremendous pressure on beds, for oxygen, and even for emergency transport. And while Mumbai, which was very badly affected, is now beginning to improve. So we are seeing a varied situation, but in many parts, it's very challenging.
So what do you attribute this surge to? Was this something that could have been avoided, or is this one of those things that just happened?
Well, it's possible that a second wave was anyway going to happen, but it need not have reached this magnitude if we were better prepared. Unfortunately, what happened was that since the numbers, whether in terms of daily case count, daily death count, or the test positivity rates, plummeted markedly by early January, an impression gained ground that we have completely eliminated the virus and turned back the clock on the pandemic, and we were ready to resume life of 2019 all over again. And there was a feeling that we had acquired herd immunity, and different theories and models were proposed. This was totally erroneous, but unfortunately, this was the dominant mood from the public as well as the policymakers, and that resulted in lack of anticipation of the second wave and lack of preparation for it, and a complete abandonment of caution.
So where is the country on vaccinations, and how much will American aid help on that front?
Well, we are really now gearing up for universal adult vaccination as of 1st of May, which means that about 75% of the population needs to be vaccinated. And even if you're really looking at the 18 to 44-year age group, which is going to start their eligibility tomorrow, apart from the 45-plus age group, which was previously being vaccinated, that brings in an additional 595 million people into the fold, which is quite a tall order in terms of the kind of vaccine supplies that we need. And right now, the supplies are limited. Therefore, whatever we can get from abroad is fine, is very welcome. But now there are all attempts being made to ramp up the production of already approved vaccines, and the way has been cleared for other vaccines that have been produced and cleared up outside by other authorities elsewhere to be also imported into India. Many of those vaccines will also be manufactured in India. So the situation regarding the supply chain should start improving from July onwards. But till that time, there is going to be somewhat of a struggle to keep the supply chain open for all the vaccines that we need to deliver to this very large number.
And I know other countries are also sending aid. So what else can people do to help?
Well, clearly vaccines are needed, and we're grateful to all the countries which are sending the vaccines that they have in reserve or canceling the orders they've already placed for India so that India can retain them. But oxygen concentrators are some things that people are really looking to in several of the cities, and now the smaller towns are getting affected as well. Personal protection equipment is something that, again, would stand in good supply. So some of these essentials are coming in. Of course, in terms of medicines, there is a reasonable amount of medicine available, but unfortunately, there is an unnecessary rush for some medicines like remdesivir and tocilizumab, much more than it's indicated. So a bit of a panic situation has been created, but I believe that will settle down soon.
President of the Public Health Foundation of India, Dr. Srinath Reddy. We appreciate your time today. Good luck to you, sir. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.